Hi, Laura. How are you
Hello,
today?
Chris. I'm doing well. How are you?
I'm great. Thank you.
Good.
Can you tell us your name and the kind of career that you are pursuing right now?
Yes. So I am Laura Nemeth, and I am a registered dental hygienist, or RDH, as we're called. I've been practicing in clinical dental hygiene for almost 16 years already. It's hard to believe it's been almost 16 years. Um, do you want me to describe kind of the roles of a dental hygienist?
That would be great.
Just
Tell
a
me what
brief.
you do. What do
Yes,
you do?
yes. So, as a hygienist, of course, we clean teeth, but it's more than just cleaning teeth. Our big thing is preventing oral diseases. So, we educate our patients about oral health. We provide preventative care. So, that includes, yes, cleaning or scaling teeth, applying fluoride treatments to help prevent tooth decay or cavities. We can place preventive sealants. We take x-rays or radiographs, and we are very thorough with recording our medical histories and dental histories. And something that you may not know, as a hygienist in Ohio, we're also able to administer local anesthetics and
Hmm,
nitrous oxide.
I see.
So, yes.
So, what kind of training do you have to be a dental hygienist? Does it vary from state to state, or is it pretty standard?
That's a good question. So you need to have at least an associate's degree or a bachelor's degree. It's from an accredited dental hygiene program. So I think all the programs in the United States are accredited, but they go through a rigorous structure of coursework to make sure that everyone is learning the same dental hygiene education. So if you have your associate's degree or your bachelor's degree, you are still learning the same dental hygiene knowledge. So all of that coursework is still the same, whether you have your associates or your bachelor's. After graduation, there are board exams that you have to complete. So there's a national board exam. It's an 8 hour written exam.
Wow.
It's a short one. And then there's a clinical exam and a state or regional exam. And then once you have successfully passed those, you have to obtain your license for the state that you're currently practicing in. So for me, I'm in Ohio. So I am licensed in the state of Ohio to practice dental hygiene. And then every 2 years, we have to renew our license and obtain at least 20 hours of continuing education. And that can vary state by state.
So, do you ever have to retest if you keep your license
As
active?
long as our license is active, you don't have to actually retest. The biggest thing is you have to keep up with your continuing education credits to
And
keep,
where do you take those? Like at university or?
they are offered in person through local dental hygiene programs, or dental hygiene associations. I'm part of my local component. So we host and put together CE classes. You can get them online through, let's say, Crest or Oral B, different. I'm trying to think what else. I'm losing my train of thought as far as who else can get the CEs, but there's so many different places you can get CEs from.
Just
Uh,
Google,
yeah, Google.
find it.
Some are offered for free online.
Oh, wow.
A lot are, you do have to pay to take the classes, but I personally enjoy doing in-person classes. I think it's fun being able to collaborate with other professionals and kind of learn from each other. So that's my preference.
So, Laura, did you know all along that you wanted to be a dental hygienist?
Actually, from a pretty young age, I had
Really?
the thought, yes.
Why?
Yeah,
Why?
I know. It's weird, I know. Um, I
No,
guess
it's cool because you wasted no time. You got straight
it's
into
true.
the field.
When I was young, it probably was when I was in junior high. I always loved going to the dentist. My hygienist was always so nice, and I enjoyed getting my teeth cleaned and talking with her. And the dentist growing up, I always had, great rapport with her. So as a young person, I thought it was kind of a cool job. And then going into high school, that was still something that was, kind of high up on my list. And I had a friend who was wanting to go into dental school. So we always thought, oh, that'd be cool to work together one day. Sadly, he lives in Florida now, but he is a practicing dentist. Um, but yeah, so I always was interested in the field of dentistry. I knew I wanted to work in healthcare. And for me, I really wanted to help patients feel at ease at the dentist versus having that high dental anxiety that so many people have. So I wanted to be able to help
What
people.
kind of person, what kind of person makes a good dental hygienist?
That is a really good question because I would say you don't always think about going into dental hygiene, and you almost have to have a little bit of a psychology background too, because
I
we're dealing with, so many different people and the dental anxieties, and just really learning on how you can help them cope and make them feel comfortable. So you definitely have to be a people person. There's a lot of talking involved and educating. Um, you have to like teeth, of course. You can't be grossed out by some blood and spit, but but you have to be compassionate for what you're doing.
So has there been a lot of change in technology over the years? Like in many medical industries, there's just constant change, but I would think there would be somewhat of a stable situation in your industry specifically.
I would say there are a lot of same or similar things throughout the years. When I went to school, I started dental hygiene program in 2007. When I was in school, we learned to take x-rays on traditional film, and then we learned how to develop that film, which I thought was really cool. And within a couple of years of being out in private practice, there was the digital technology coming out. So I learned on the job training taking digital x-rays. So for me, that was probably the biggest change since I've been a hygienist, um, making that big transition. But I think I appreciate it more because the time it saves with digital versus having to take the time to develop film, and being able to show the patients on a large computer screen versus just a tiny little film makes a big difference.
Yes, yes. So, what is the most rewarding part of your job? You've already said that you love helping patients through their job or through their appointments and maybe even their whole life because you probably form relationships with patients. What, give us a great example of why your job is perfect for you.
I guess, you kind of touched on a big part of it. I think my biggest thing is building trust and rapport with your patients. It's essential. Hygienists, a lot of times, we're the first point of contact in a dental office. And I've always really had that drive to help people feel comfortable and, just helping reduce the fear. And I think I get so much out of it when, the dentist comes in and they're asking the patient, how did your appointment go? And I hear, oh, it was great. I just love seeing Laura. I come back because I get to see Laura. And to me, that just makes all the difference in the world, knowing that I not only am helping take great care, but it's also impacting their lives too. And they look forward to coming back.
True, true. And maybe there's a little girl in your office who's thinking about being in your job one day because of
Yes.
you.
And actually, at an office I worked at prior to where I'm at now, that is exactly what happened. I
Oh,
had
yeah.
a young patient. I started seeing her when she was maybe 10. And fast forward, she ended up shadowing me at the dental office I work at currently. And she is now a registered dental hygienist. And she said,
Wow, that's
because of
cool.
me. So,
That's cool. That's very cool. All
so I
right,
thought
tell
that
me
was,
what is the most surprising thing that's ever happened in your job?
oh goodness. Surprising. I have a few stories, but I don't know if I could say them.
Why? You can hide the details.
I think just different quirks that people have. Um, I know people are always shocked when I tell them things that patients may disclose to me. It's kind of
Oh,
going to the hairdresser and, it's kind of the gossip, but I hear a lot.
really? I would have
Yes.
never thought that.
Yes. Is there anything specific you can think of? Like, I'm trying to think of anything in particular. Nothing's coming to mind at the
That's all
moment.
right. That's all right. That's okay. You're probably like, oh, I definitely can't tell her these 15
I know. I could
things. That's okay.
I could
So,
go on and on.
if there's someone watching right now who thinks that this is definitely the field that they want to pursue, what kind of advice would you give them for right now? What should they be doing? What would make this a field that they shouldn't pursue? What are the things that they should be considering or trying?
I definitely doing taking classes in science, biology, chemistry, dental hygiene. We have the same prerequisites that a nurse would have. So you want to be interested in the sciences, anatomy and physiology. So taking those core classes to see if that is something that is of interest to you. And also, I would highly recommend shadowing at a dental office. So that can be either, yes, this is definitely what I want to do, or they go in thinking it's something totally different and they realize, no, that's not for me. So it's a very tough program. So you want to make sure that it is something that you're interested in.
They just call the local dentist and say, I want to do. Really? That
Actually,
simple.
yes, they could say, "Hey, I'm interested in pursuing a career in dental hygiene. Is there a chance I could come in and shadow your hygienist for a few hours?" So we've had, quite a few people do that.
Wow, that's great.
Yeah, and we're very
Is
open to it.
is there anything else you would like to offer during the interview that we didn't cover?
Trying to think. One thing that I did in my own personal career, I did graduate from Lorain Community College with my associate's degree. And then in 2019, I knew I always wanted to go back and get my bachelor's degree. So I went through the partnership through Youngstown State University, and I did complete my bachelor's degree. So that's something that I was very proud of, and I would suggest doing that as well to anyone that's looking into doing this field.
Well, that's nice that you worked and then you at your own pace decided to go back and finish that. That's nice.
And it opens up more avenues if you're ever interested in teaching or working in public health. If you want to get out of doing clinical dental hygiene, it gives you more options. So that was
Okay, you said clinical dental hygiene. What is the
yes.
difference? What are the other options other than clinical
Doing
dental?
clinical. The biggest would be if you wanted to be a teacher, teaching in a dental hygiene program,
Right.
or doing more administrative work in public health, doing things in the community. And also, you can even be a sales representative for Crest, Colgate, different dental companies. So there are other options too.
That's true. Well, if someone is watching this video and would really love to communicate with you about this profession, would you be willing to connect with them through our website?
Most definitely. I would love that.
Thank you so much, Laura. It
Yes.
was fun. Thank you.
Thank you.
Have a great day.
You too. I appreciate it.